Hi guys, welcome back to my videos on Australian Medical Council examination and the pathways. For those who guys who don't know me, my name is Dr. Rosna Varghese and I did clear my MCQ examination last year in August 2023, and I've been wanting to share my the way I studied with you guys for so long, but here I am. I just got the time to do them now. So today we will be discussing mainly about what materials I used and how my preparation went. I hope this will be helpful to the few of guys who were asking me to share my experience about doing the examination. So the picture that you can see behind is basically my study table. You can see it was really colorful. So that's something I would advise you guys also to do. Make small sticky notes and stick it onto your tables, all the important points that you find while you're reading through your textbooks, because at a glance towards your examination, these sticky notes are going to be really helpful for you guys. So making your wall colorful is actually pretty good, and I would really suggest you guys to do something like that. And having a calendar and making sure how many days you have until your exam is again something that really helps you stick on to your timetable and work more harder. So yeah, so that's just the overview of my table. So I'll tell you all about how I prepared for my examination today, and let's get started. Okay, guys, so with the materials that I used to prepare, so in the following slides, I'll be showing you all the materials that I used for my preparation. But the most important books for your AMC MCQ examination are these three books. And even if you look in their website, they would be suggesting you all these three books. But in my case, I would say the John Murtagh is the most important book, and so is your Handbook of Multiple Choice Questions. This is a book that is released by the Australian Medical Council itself. We have no other books that is being, if I'm not wrong, we don't have any other books apart from these two books that are released by the Australian Medical Council to get an idea about how they frame their MCQ questions, what are their topic of interest, and how they want you to answer these 8 type MCQ questions. So these are the only two books that AMC is releasing for your MCQ examination, and because of that, these two books are really important. And John Murtagh is basically the Australian textbook, which has all information, like every topics that we did for our undergraduate MBBS is there in this book. If be it ENT, be it ophthalmology, be it the medicine, surgery, gynecology, orthopedics, everything is concised into this book. So because it's a lot of information, a huge information, it's concised. It's not so much as like if you take our Davidson medicine textbook, we have a lot of information about medicine, right? So it's not that vast because the book contains a lot of topics. It's not just medicine, it's not just obstetrics and gynecology. Because of that, you need to read John Murtagh from top to end, cover to cover. You need to learn John Murtagh completely. There is no other book that we need to give as much of emphasis that you will be giving to John Murtagh. This is the most important textbook. But because this book is not as vast as other textbooks, because it includes a lot of things together, you will need to refer a few other Australian textbooks also to get an idea about a lot more other topics which might not be completely mentioned in John Murtagh. John Murtagh is a very good textbook, but the problem with the index is that it is kind of disordered. It is not arranged in a proper way. For example, if we take our Davidson medicine textbook, we have all the topics of nephrology together, cardiology together, but in John Murtagh, the sequence is kind of disorganized. Although there are some areas which are organized, but some areas can be disorganized too. You might find few topics of orthopedics in few other headings, and then few other topics will be elsewhere. So it's kind of disorganized. That's the only thing you need to be careful when you're reading John Murtagh. I'll tell you how I did with the index and how I read through John Murtagh in a second. So that's about John Murtagh. And the Handbook of Multiple Choice Questions, this is a very important textbook, guys. So this is, although this is a textbook that, if I'm not wrong, it's about 15 to 16 years old now, and I don't think they have released a newer edition of this book. It's still the same old book that we are following. So there might be few changes in the guidelines, and there might be few changes in the answers given in the handbook of MCQ, because Australia revises their guidelines continuously. So there might be changes, but this book is really good because it gives you an idea of how to answer an A-type MCQ questions. So it has got two parts. It's the section 2 and a section 3 with multiple questions. This book is also organized into, topic wise and subject wise. It's a very beautiful book that you need to read cover to cover. And I want you to do this book at least twice. If possible, at least once you need to cover it up, but if possible, do it at least twice. You can do this book, keeping the timer on also. Like what we did was the section 2. I don't remember how much questions were there, but we used to set time and we used to do a mock test of the section 2. Section 3 is basically divided topic wise, but section 2 is actually a mix of all the topics. So we used to time ourselves and do a mock test out of the section 2 within the handbook. So it's a really wonderful book. It has got questions and it tells you the entire details of answer also, like how they ruled out each options and why it is that particular option that is the answer. So this is a wonderful book, guys, and John Murtagh and the Handbook of Multiple Choice Questions, these two books are something that I want you to read cover to cover and be perfect with that. Okay. Another textbook that AMC tells you is the annotated AMC MCQ book, but it is also a good book. I had only referred few questions from there. I couldn't do this book completely because of the lack of time. But if you guys do have time, I would definitely recommend you to do this book also. This is also another wonderful book that has been released by the AMC, the Australian Medical Council. So these three books are basically the Bible for AMC that I want you to read completely. Okay. Yeah, so as I mentioned, because John Murtagh is not that much vast enough to give you all the information that you might need to widen your knowledge and, increase the concepts that you need for dealing with the MCQ questions, you might have to refer a few other textbooks. So these are few Australian textbooks that I used, or maybe you can use for your reference. The textbook of Obstetrics and Gynecology by I'm not particularly sure how this is to be pronounced, but I think it's Lillivan and Jones. So this particular textbook was really a wonderful textbook that I used to refer more about obstetrics and gynecology. So back in India, I used my textbook for obstetrics and gynecology. That was the textbook by Dr. Sheila Balakrishnan, madam. And that was a really wonderful textbook. And I did refer my Indian textbooks also. But the thing is, to get a hand about how things are dealt with in Australia, the Australian way of training into these specialties would be a little better. So you can look through your Indian textbooks to get the concepts, to get an idea about the things. But a few management protocols might be a little different in Australia. So it's also good that you refer your Australian textbooks to get a better idea. John Murtagh, although it covers multiple topics, the information that you might need to widen your knowledge will not be as much. There wouldn't be as much in John Murtagh. So that's why I would recommend you to, refer these textbooks if you want to get a wider idea, wider knowledge about how things are done in Australia and to get an idea about the topics. So this was the textbook of obstetrics and gynecology that I referred. Few topics I did refer from this textbook, and this is a very wonderful book also. It's very friendly to read and understand things. Another textbook that I used was the textbook of surgery by Tejendra, if I'm not wrong, Tejendra. So this was also a very wonderful textbook to get a lot of idea about how they need the Australian medical graduates to understand surgical training and their way of doing things and their way of managing things. It's not very different from what we learn in India, but see, as I mentioned, it's always good to have their perspective of approaching topics in surgery, or their perspective approaching topics in medicine is always good because we are intending to move to a different healthcare system. But I did refer my surgical textbooks back in India, the Bailey, the SRB. These are all just wonderful textbooks that you do have to read through in order to build your concept back again if you've forgotten about them. So these were the two main textbooks that I did refer externally for OBG and surgery. Now, Good Medical Practice is another textbook that the AMC website shows for learning ethics. To be honest, I just read through a few pages and I couldn't read through them. And moreover, ethics is like a gut feeling, guys. How much ever you read and learn about ethics, you can get few questions wrong. You can have a gut feeling and you can get the questions right. So I wouldn't recommend you to read through and study ethics in that much amount of time, because in the previous video, if you might have seen, the greatest weightage of questions goes for adult medicine, 30%, and it's only 12.5% that contributes to ethics and the population health together. So I wouldn't recommend you to spend a lot of time dealing with ethics because, see, it's gut feeling. How much ever you learn, the ethics in Australia cannot be completely grasped. You need to slowly learn them, and the contribution of ethics to AMC MCQ examination is very less. So I would not recommend you to spend a lot of time reading them, but if you do have time and if you are a very fast and quick learner and reader, obviously this book is a recommended book by the Australian Medical Council to learn more about the ethics. Pediatric Handbook, this was another book that I found that can be referred to, but to be honest, I haven't referred to this book for my studies. I mainly did my pediatrics reference from the RCH website. So RCH website is a wonderful website that you can get every information about what the condition is and how you manage all pediatric conditions. Um, so RCH is Royal Children's Hospital. So they do produce a lot of, I mean, they do make a lot of guidelines, and their website has got a lot of information. For example, if you want to learn about bronchiolitis in pediatric case, just type in Google bronchiolitis RCH guidelines Australia, and you will get the guidelines from RCH. And that's the best way to learn pediatrics if you want a further reference apart from John Murtagh. But this is another book that you guys can refer if you want. Now, all these books are available in the PDF format. Whatever books that I'm telling you, I have not bought a single hard copies. I had all of them PDF. Just the textbook of John Murtagh and the handbook of MCQ, both of them I had taken printouts because I'm not a soft copy person. I'm not a PDF person. I want books in my hand. I want to underline them, read through them again, make it colorful in order to get things into my head. So because John Murtagh and the AMC MCQ handbook are the most important books, I did take printouts of the entire book because I couldn't buy the book back here. So what you can do, maybe if you are a PDF person, if you are a very technologically advanced person, you can use the PDF files for all these books. They're all available. And if not, if you want the hard copy, well, I would only recommend you to take hard copies of John Murtagh and the MC MCQ handbook, and not to buy all the hard copies of these reference book because you're not going to study cover to cover. You will just need to refer if at all you want to know anything extra about how Australia deals with these topics. But otherwise, I wouldn't recommend you to have any hard copies of these reference textbooks, right? So yeah, these are a few other reference textbook I used. Now, a few other reference textbooks that I used, the Red Book. This is a Red Book, RACGP Red Book. It gives you a lot of idea about the screening guidelines. But to be honest, guys, a lot of screening has changed. Like, for example, the cervical screening test have changed. They keep revising their screening schedules. So if you want, you can look through these Red Book, but please go to their websites, go through the Australian guidelines again, search in Google and see if changes have been made always. But one of the recommended book to learn screening guidelines is this Red Book, but just make sure it is the most updated version that you are studying. The USMLE Book of Medical Ethics, this was one other book that I read through to understand ethics, the ethical aspect of dealing with medicine, because I wasn't so much aware about medical ethics. So this book really helped me to get an idea. But the thing when you're reading this book, guys, this is a US textbook. It's not Australian textbooks, and few guidelines are different. Because, for example, the way you deal with euthanasia in the United States is different from the way we deal it in Australia. So have that in the back of the mind. This book is just to get an idea about how things are dealt in an ethical way in all these English speaking countries, but you need to make sure that these are the American guidelines and not Australian guidelines. This book can be referred to just to get an idea, but do not by heart them. Do not take in all the concepts given in USMLE because there might be changes in the Australian guidelines. I did find few changes like in euthanasia. It's just one example, but this is just for an idea, not for learning them and by hearting them. Now, this particular textbook, the Step 2 CK Psychiatry and Biostats textbook, it is also a USMLE textbook, guys, but this was a wonderful textbook. I did read this textbook cover to cover. To be honest, I understood and I learned psychiatry from this textbook. I also learned more about the epidemiology or the population health because there are some biostatistic questions which needn't be something that you might be really thorough about once you complete your medical school. So all those I got idea from this book. I didn't go through the ethics part in this textbook because again it's a USMLE textbook, but the psychiatry and the epidemiology, that is the population health, doing the biostat questions was really helpful from this textbook. So this is one other textbook with the other textbook that I told you about that I referred for psychiatry and biostatistics. But again, the management guys, for whatever management, make sure you learn the Australian guidelines. All these textbooks are just reference textbooks to get extra idea, extra knowledge to, spread your knowledge and understand the concepts. But the management need to be Australian guidelines that you are learning. Okay. So this is just the same slide that I put it in the previous video that I made. For you guys who haven't seen my previous video, these are the topics that AMC wants you to learn. It's just the same topics that we have covered in our final year. We need medicine, the adult health, surgery and orthopedics, the women's health, that is the obstetrics and gynecology, the child health or pediatrics, the mental health or psychiatry, which includes all age groups, including pediatric psychiatry topics need to be learned here, and the population health and ethics. So these are the different topics that we need to study, that is there in John Murtagh, and the topics that you need to refer. And whenever you're learning any topic for MCQ, guys, you need to know the disease process, the pathogenesis of that condition. You need to know about the clinical features, because all the cases that we have for AMC MCQ, these are clinical scenario cases. If you don't know the clinical features of how a particular condition is presenting, it will be difficult for you to diagnose it, right? And you need to know the investigation. They might ask you for the best initial investigation or the most appropriate investigation to diagnose this particular conditions. And sometimes they will give you the investigations and the findings. You might have to understand and diagnose what condition it is. So it's equally important to find what understand and learn the investigations that you need to do, the initial investigation, the most appropriate investigation, the gold standard investigation. They're all important, and you need to know about what findings you get in those conditions also. Obviously, this will be the way you guys will be learning, but I'm just emphasizing how important it is. Okay, you need to know the differential diagnosis of that condition and the management. We already did the investigation. Management includes both investigation and the treatment. Again, treatment also, they will ask about what is the most appropriate treatment and what is the initial treatment that you give for the patient. So it keeps changing. Their question keeps changing, keeps confusing you guys. So when you're learning investigation and management, make sure that you learn what is the initial investigation, initial treatment, and the best treatment or the most appropriate treatment. So they can, twist the questions and ask. So you have to be very vigilant when you read the questions. So these are the topics that you need to cover and learn when you are going through John Murtagh or any other topics that you are learning. So these are few other textbooks that I saw and read that people had referred to, but to be honest, I haven't referred. I did refer a few topics from Oxford Handbook of Clinical Surgery, but otherwise these textbooks weren't something that I used. I haven't used them, but I've seen people referring to these textbooks also. So if you need to learn a little more about surgery, maybe this textbook is also good, but these are not Australian textbooks. Even the USMLE Step 2 Surgery, these are not Australian textbooks. I would recommend you to just learn Tejendra, the surgery textbook that I told you about from Australia, if you want to refer anything more about surgery. But if you still want to refer something extra that's not there in any of those textbooks, you're always welcome to look through these textbooks also. But make sure you learn the Australian guidelines, okay? Now, this RACGP Silver book is again another Australian textbook that if you want to read and learn more about geriatrics or elderly care, elderly abuse, this is one of the book that you can refer to. But see, the weightage of having elderly questions is very less, so don't sit and read them. Maybe for reference, this book is something that you can use, maybe just reading 1 or 2 lines, but I wouldn't recommend you to sit and read this book because we have a lot other things to learn. Okay, going through every single book is not humanly possible for us. So if you want to read more about aged care and geriatrics, maybe this book is something that you can look. But to be honest, guys, these aren't books that I refer to, but I'm just telling you guys, if you want to widen your knowledge, you can always look through these books also. Now, these are some reference websites that I used. So as I mentioned, if you want to read and learn anything extra apart from the topics that are there in John Murtagh, which obviously you should, you have to go through Australian guidelines. So whatever topic, for example, if you're reading through pulmonary embolism, you want to know a little more about the guidelines. One thing, guys, keep updated because the guidelines changes, the management changes. So please do check the guidelines and make sure whatever you're reading and learning through John Murtagh is the newest guidelines and they're the updated guidelines. Okay, so please do check these reference websites for the management. Whatever you're searching, like I said, if you're looking through pulmonary embolism, you can just type RACGP guidelines for pulmonary embolism and you can search, or maybe you can search for pulmonary embolism Australian guidelines. All the different Australian guidelines will come up, and that'll be helpful for you to review and learn more about the particular topic. But the thing is, some management can vary from state to state. There can be some changes, but just read and understand how in overall things might be done. Now, as I mentioned, please do learn all the Australian guidelines, whatever other textbooks that you're referring to at the end of your study, you should be learning the Australian guidelines only, because AMC MCQ examination is obviously going to look for Australian guidelines and not any other guidelines that you learned back in your home country. Okay. Another very good website that I used was the Department of Health, that is the health.gov.au, because if you want to know about the immunization schedules and the different types of vaccinations, this was a very good website that I used. Also for the screening guidelines, because we have the bowel cancer screening, we have the cervical cancer screening, and a lot of other screening that are there in Australia, that particular age group people, they do screen if they are at high risk, and what are the factors to call them high risk, and if you categorize them as high risk, you need to do a few extra testing or you change the way of testing them. So all these screening guidelines are very important for those of you guys who have not started your preparation. Screening guidelines is really important, and it's something that we do undertake in Australia. So you can read through about these screening guidelines from the Department of Health. I did tell you about the Red Book where screening guidelines are available, but make sure you counter check, cross check with this website also to make sure that the screening guidelines are the most updated one that you're learning, because depending upon the researches that they do and the efficacy of the testing, they do keep changing the guidelines. So you have to be up to date whatever you are learning. Now, as I mentioned, RACGP guidelines is really good for all the medicine topics, the internal medicine topics. RCH guidelines is something that I referred a lot for pediatrics, and they have written it in a very beautiful way, and you will really understand the topics really well. So RCH guidelines is really good for pediatrics. Another website that I used was the Imaging Pathway Australia. You can just type Imaging Pathway of Australia, and they will give you the entire pathway of how to go about with management. That was really helpful. For example, if you get a patient diagnosed with pulmonary embolism, what to do immediately, what test to do, if this particular test is contraindicated. So the entire the entire family tree of the way of managing, the way of doing investigations and treating would be given in this Imaging Pathway. When you go to Imaging Pathway, a lot of topics are there. You can go through respiratory topics, cardiology topics, gynecology topics. Everything is there in this particular website, and this is again a wonderful website that you can use for reference. Life in the Fast Lane was another website that I occasionally use to understand a little more about ECG, X-ray findings, and ABG and other emergency medicine topics. Driving is one other important topic that you need to learn, because questions might come like this patient has been recently diagnosed with diabetes, so how should we change about the way in which they are driving? And this patient has been recently diagnosed with a seizure or an epilepsy, and we just started medicine, so can he drive? How much period of not driving should they have? I mean, like, how much period should they not drive when they've started on an anti-epileptic medication? So driving is something that's really important, and you can go to Austroad's website to know more about all these driving guidelines. To be honest, I had made a list of all the back when I studied. I do not have the paper anymore. I will have to search for it, but I did make a list of all conditions that are commonly asked in AMC, and how much period of abstinence you need from driving if you are diagnosed with that conditions and if particular medicines have been started. So driving is a very important part that you need to learn about, and you can go through Austroads for that. As I mentioned, state-wise websites can also be used. There can be changes in guidelines, minor changes, but just get an overall idea about how you manage things. aci.health.nsw.gov.au. This is a website of the New South Wales, and I use this website mainly to deal with all the emergency conditions. Their website is also really good to get an idea about all that. The South Australia Health, or the SA Health, is another website that I did use a lot, especially for obstetrics and gynecology, because their PDF files are also really good to understand the concept and understand the management. So basically, all these websites that I refer to is to know about the management and the way you treat them. Okay, so these are some of the guidelines that I referred, and I would definitely recommend you also to go through these websites to understand a little more about the conditions. Now, reading through the textbooks, going through the websites, having a grasp and the knowledge of the topics is not enough. You need to know how to do the A-type MCQ questions, and you need to manage your time, and that's the most important thing, time management. So these are some of the question banks that people preparing for AMC use. You have the M+X, you have the AMEDX, and sorry about this is for. This is actually the USMLE World Bank, but this particular question bank was really good to understand concepts of psychiatry, because psychiatry has to be learned in a little more vast way than how we learn for the undergraduate studies. You will have a little more details about the pharmacology that you need to know. So this particular question bank gave me an idea to learn more about psychiatry topics. Now, with regards to AMEDX and MPLEX, guys, you do have a lot of offline files available. I would recommend you guys to complete those offline files, and then towards your exam, maybe you can take online files, or maybe take a subscription for these AMEDX or M+6 and use them. But it's up to you. If you guys want to use the subscription one, the newest one, you can go for the subscription. But you are already spending a lot for your AMC examinations. If you want to save some money, maybe you can try the offline files also. But again, the thing is, you need to check how you know how old these offline files are, because changing guidelines will be there and the management can change. So stay updated. Even if you're doing the offline files, stay updated. You need the newest version of management to be there for your exam. Now, with regards to M+X and AMEDX, guys, they both are good. I've used both of them. They both are really good. They give you beautiful questions and a beautiful explanation of how to deal with questions. I did offline files of AMEDX, and I did subscribe M+X close to my examination, because we also need to time ourselves, and if possible, mock test should also be done. Mock tests are available in M+X, and I took M+X because the questions were a little more advanced and difficult, to be honest, and I just wanted to have an idea how difficult question comes. So M+X is what I subscribed, but I equally did AMEDX offline files also, and AMEDX was equally good. I am not sure to talk more about AMEDX because I didn't take their subscription, but M+X was really good, and you also get some notes along with the M+X subscription that you take, and these notes are also good to get a concise overview idea of all the topics that you have learned. So what I did was I took M+X only towards close to my exam, because I need to have an idea of all the topics. You need to have an idea of all the topics before you start solving the MCQ. So that's what I did. I started doing question banks only towards once I completed all my topics for the examination. With the mock test, guys, doing mock tests are good, because you will understand how much you are able to manage your time, because it is difficult to manage your time for examination. Although you say 150 questions in 3.5 hours, you have enough time. Trust me, guys, for the exam, you do not have enough time. You will be stressed, and you will lose half of the time stressing about the questions. And AMC has a way of confusing you guys. And, you will sit and think, is it A, is it B? And you can lose your time. So doing mock test is obviously good. Mock tests are available in the AMC website. I think a 50-question mock test is available just to manage your time. I did do the mock test in the website. You have mock test in AMEDX, and I think it's also there. I mean, you have mock test in M+X. I did take the M+X subscription, and I think you do have mock test in AMEDX also. I'm not sure because I didn't take their subscription. Doing their mock test is really good. They do have 3.5-hour mock test. The entire 3.5 hours you can sit. You can check if you're able to sit for 3.5 hours and do it also, and you'll be able to manage your time. But to be honest, I couldn't do the 3.5-hour mock test from M+X. Although I subscribed, I didn't get time to do that. I was going on revising and covering my topics. But if you can do the 3.5-hour mock test from M+X, it's really good to have an idea of how well you are able to manage your time. What we did, me and my study partners, what we did was the handbook section 2 that I told you. So it's a mix of all topics. It's jumbled questions. It's not organized like this particular questions from cardiology, questions from psychiatry. It's not like that in section 2. Section 3 onwards, it's all organized and topic-wise questions. So that's why we use the section 2 mainly to do a mock test. We used to do the entire section 2. How much of a question is there? We used to divide it and put the time accordingly. And we used to do the section 2 as a mock test. That's something that you guys can do if you are afraid to sit for 3.5 hours and do the mock test of M+X or Amidex. But I would recommend you guys to definitely do a 3.5-hour mock test if you have the time. I didn't get the time, but it'll be good if you can do, because I had time management issues and I don't want you guys to have the same. Now, when you're doing, time each question. Okay, like for example, even if you're doing 5 questions, guys, see, we have 150 questions in 3.5 hours, right? So do the math. You will have to complete one question in 1 minute and approximately 24 seconds, right? So even if you're doing 5 questions or even if you're doing 10 questions, you set the time accordingly. Set the time that you will not spend more than 1 minute and 24 seconds for one question. If you want, bring it even close to 1 minute. Do not spend more than 1 minute for a question. So you are learning how to manage your time. Even if you're doing 5 questions, even if you're doing 10 questions, time it and do. I used to do it like that. Time yourself. Even if you're doing 5 questions, time yourself for that and do it. So you'll get an idea of managing your time, right? Now, I'll just tell you about how I prepared. So basically, I had 5 months of preparation, and people say that you need at least 5 or 6 months of preparation. Um, for me, I was not working, so I studied about 9 to 10 hours every day, just 6 days a week. I made sure I did not learn one day per week. I just gave myself the time to rest and enjoy myself for that one day. But people say that you need at least 6 to 7 hours of study for at least 5 days a week. That's the average time that people say when I talk to a lot of my friends who studied also. But what I did was, I'm a slow learner. I need time to learn. I need to understand concepts. I need to, learn a lot about a thing. So that's why I had to spend about 9 to 10 hours per day. And towards closer to your exam, guys, you need to spend more time. You need to study for 10 or 12 hours. No compromise on that, because you're spending a lot for this examination. You need to do the best preparation that is possible. Now, when I studied, what I did was I used to divide my topics. As I mentioned in John Murtagh, it's all disorganized. So what I do was I used to make a list of all the orthopedic topics that is there in John Murtagh, all the cardiology topics that is there in John Murtagh. So the numbers would be disorganized, right? So maybe 31st, chapter 31 would be a cardiology question. Then you will get a cardiology topic in chapter 44. So I used to make an organized list of what all topics were there in John Murtagh under that particular section that we need to study. And I used to study topic wise. For example, if you're studying medicine, divide medicine into respiratory. You have GIT, you have cardiovascular system, you have the renal topics, you have the rheumatology, endocrine, and CNS. So these are the topics that you have in under medicine. So divide the medicine topics under these headings, and then you need to give yourself time to prepare. To be honest, guys, 3 days is enough for you to cover GIT. 1 or 2 days is enough for you to cover respiratory. Topics are less in respiratory. When taking cardiology, guys, maybe give 3 or 4 days for cardiology. For renal, again, 1 or 2 days is enough for renal. Rheumatology, again, 1 or 2 days is enough. The topics are very less. Endocrinology, you can give 2 to 3 days. And for the central nervous system or the neurology topics, maybe give 3 or 4 days. So this was how I divided my topics. And what I did was I divided. First of all, I would read John Murtagh. I would refer the other reference textbooks. I would refer to guidelines. I would refer my Indian textbooks to get an idea. After studying the topic completely, for example, if I was studying the respiratory system, I would read all the topics under respiratory system that is in John Murtagh, refer the textbooks, refer the guidelines. I would make notes. Making notes is important, guys, because close to exam, you cannot open up your John Murtagh and read everything, right? You need to make notes of all the important topics. So I used to make notes. And after studying the entire respiratory questions, entire respiratory topic, what I would do the handbook questions. As I mentioned, section 3 in handbook, they're organized topic wise, right? So go to section 3, take the respiratory questions, do all the handbook questions. Time yourself there and do the handbook questions. Then I used to do all these offline question banks that I had in my hand, not the subscription one, but if you guys have subscription, topic wise questions are available in M+X and AMEDX also. You can do that. What I did was I used to do the offline files, and then I used to check for some recall questions and do them also. You get a lot of recalls from all those social platforms. Go there and find a lot of recalls related to the questions and do the recalls also. And then once you do all that, your particular topic is done, right? You took respiratory system, you learned the entire topic, you made notes of that, and you did the handbook questions, you did the question bank questions, you did the recall questions. Guys, the topic is done. So that's how I prepared for my examination, and I think this is a really good way of preparing and getting an understanding of the topic. So warning guys, please do not learn anything that I've written here. Things might have changed, the guidelines might have changed. This was back when I studied. So as I mentioned, I did not have the John Murtagh textbook with me. So what I did is I took printouts of the important topics and I just, made it into a file and just labeled them topic wise. And that's how I learned. So I just marked P for the printed notes and O for the notes that I'm looking online. So for the small topics like painful ear, it's just small. So I just made a note of it looking it in the online PDF. I did not take printout. But for really huge chapters, I did take printout and I did make notes also. At the last reference, guys, you need your notes. Okay. So what I did was like this. For example, see the topic numbers are not complete. Okay. There are still more topics. I made a heading of rheumatology. Chapter 21, chapter 25 would be rheumatology. So where is 21 was, sorry, chapter 21, that would be connective tissue disease and systemic vasculitis. So that was a rheumatology topic. So see, the questions are all disorganized. You have then chapter 25 that is under rheumatology, arthritis. So it's not together. The sections are not divided properly. So that's why maybe taking a heading and noting down all the chapters that you have under that heading would be helpful for you to revise. So these were the questions that I found under ENT, ophthalmology, psychiatry, surgery. So make a note like that, guys. So what the list that I've made needn't be complete. There might be still other questions. This was just a rough copy that I made, but I think if you guys do it this way, it'll be helpful for you to read through and understand John Murtagh a little better. So this is just the other, continuation of the index that I told you about. Few sections are organized like these the part 6, these are completely pediatric topics, so that's organized well and good. Pediatrics have a complete section. Even the obstetrics and gynecology has got a complete section. The male health questions are also all together. So ones that are together, that's good. See the dermatology, they're all together, that's good. But the things that are disorganized, maybe making a note would be helpful. Guys, warning, please do not look and learn anything from this paper without referring the current guidelines. I did my examination 1 year back, so please do refer the current guidelines and do not by heart anything that I've written in this paper. Okay. So I'll just tell you how to solve the A-type MCQ questions. I know you guys would know, but I'll just tell, for those who are not aware of it, I'll just tell you how I used to prepare for my MCQ. So this is one of the questions from the AMC MCQ handbook. So let's do this question. A 5-year-old boy complains of acutely painful defecation with spotting of blood on the toilet paper. Which one of the following is a most likely diagnosis? So this is a very simple question, guys. So when you see the question, go to the options. Intussusception. Think about intussusception. They are mostly seen up till 2 years of age, and I don't think it will be likely in a 5-year age. And even if it happens in a 5-year-old, see, you need to have abdominal pain, right? The patient should have abdominal pain, and it's not likely to come with a painful defecation and spotting on the toilet paper. They would have red currant jelly stools, right? That's the key feature of intussusception. So do you guys think it's A? No. So rule out option A. Next, you go on to anal fissure. Okay, so option B, anal fissure can be a possibility because, 5-year-old children, they can be constipated. They can have this aversion to go to toilet and they will not pass their stools, and they can have hard stools also. So this can lead to a painful defecation when you're having hard stools, and there can be tears in the mucosa there, and that can lead to spotting also. Yes, so anal fissure can be an option, right? So keep B in your mind. Let's just check and roll out other options also. Meckel's diverticulum. Now Now, Meckel's diverticulum would present with central abdominal pain, and even if bleeding occurs, it has to be really profuse bleeding, and there will be significant drop of hemoglobin. It's not going to be some spotting in the toilet paper. So I don't think it's option C also. Now, juvenile polyp. Juvenile polyp, again, it's quite unusual in this particular age group, and also, even if it's asymptomatic, and even if juvenile polyp happens, it's likely to give you some blood that's mixed with your stools, and not likely to give you some spotting in the toilet paper. So I'm ruling out option D also. Henoch-Schondin purpura. Well, Henoch-Schondin purpura, as you guys know, it comes with a tetrad of features. You will have arthritis, you will have the rashes, right, the palpable purpura, you will have the hematuria, and you will have abdominal pain. You do not have any of those features in the question. And although Henoch-Schondin purpura can complicate to intussusception, I don't feel it's intussusception either, because there is no red currant jelly stools. It's just a painful defecation and spotting on the toilet paper. So what do you guys think? We did rule out option A, C, D, and E completely. There are no features to say that it is these options. So my diagnosis will be option B. So, or anal fissure. So this is how you should do your MCQ questions. Rule out every options. So see, this is an easy question. When you come to complicated questions, surgery questions, where they're asking for you the most initial investigation for appendicitis, the most best most appropriate investigation for appendicitis, things can get confusing. So you need to make note and read and study all those topics. So this is just an easy question that we have, but this is how we do rule out each options, and that's how you come to a diagnosis. When you're doing few other questions, and even in the same question, guys, one advice that I would give you is, when you are learning through these options, make sure you read a little bit about intussusception. As I mentioned, intussusception, what age does it happen? What are the clinical features of intussusception? How does it present with? So learn a little bit about intussusception when you're doing this question. Don't spend a lot of time about it, because you are going to read and study pediatrics anyway, and you will learn about intussusception. But make sure you understand why you're completely ruling out these options. And for that, you will need to learn about intussusception. When you, obviously, with this question giving the answer of anal fissure, you have to read and study about anal fissure. Meckel's diverticulum. Again, you can just read through the presentation of Meckel's diverticulum, the investigations and the treatment you need to do if you get diagnosed with Meckel's diverticulum. Similarly, juvenile polyp, and also read through Henoch-Schondin purpura. That's how we do A-type MCQ questions. You need to rule out each options and find the most appropriate option that can come as the answer in that question, and make sure you learn about every other options also, because that will make your job easy when you're solving other MCQs. So this is how the AMC MCQ handbook frames their answer. Just in the same way, guys, it's a beautiful way how they frame their answers, and you need to, that's why I said you need to learn the AMC MCQ handbook. See, anal fissure, it's very common to cause rectal bleeding in childhood, and because children can have a very hard and constipated stool, and this will cause a very bright blood on the surface of the nappy or the toilet paper. So that's why the answer is anal fissure. Now, why is it not the other options? They do give explanation for that also, and that's how you should learn. So each of the other options, like intussusception, Meckel's diverticulitis, or juvenile polyp, or the HSP, they can cause rectal bleeding as a complications, but it doesn't approach as much as how anal fissure approaches to this question. So that's why we're ruling out. It can, see, all these other options can also be a possibility, but it's not as appropriate as anal fissure. That's why we're ruling them out, right? So while intussusception occurs acutely, it is usually associated with bouts of colicky pain, distressing the child, who may look quite obtunded after the bout. And the stool appearance would be red currant jelly. I did not get any of these features in my MCQ question, right? So that's why we're ruling that out. With Meckel's diverticulum, again, you should have a central abdominal pain. And even if you have, it's going to be a profuse blood loss and severe enough to cause significant drop in hemoglobin rather than spotting on a toilet paper. So ruled that one also out. Now, juvenile polyps, these are unusual and they are asymptomatic generally, but even if the bleeding occurs, see, it's going to be mixed with your stool rather than on the paper. So we're going to rule out juvenile polyps also. Now, what about HSP? HSP presents with abdominal pain, the vasculitic rash, the periarticular swelling, and the painful joints of the arthritis, and it may be associated with intussusception as a complication. And in that case, again, you can have pain, you can have bloody stool, but it's not spotting. It's not per se a painful defecation. You will have a lot of other features also to be mentioned. So that's how we come to this particular diagnosis of anal fissure. This is how you guys should do every single MCQ questions when you're preparing for the exam. On the exam day, when you're going through the question, guys, there you can quickly rule out all the options. You don't have to think more, quickly rule out all the options. But when you're studying these MCQ questions, make sure you learn every single options and why they are not the answers also. Okay. So I thought I'll just answer a few frequently asked questions or questions that might have come up in your mind when you are learning for the AMC MCQ examination. I did have a lot of doubts and a lot of confusions when I was learning my AMC MCQ examination, and I did not have anybody to help me out with it until I went through the entire journey. Thinking back, I think there are some things that I want you guys to know. So I'll just be helping you out with that. And if you guys have any other questions, please do mention them in the comment box so that I can come up with another video clarifying your doubts so that we can all reach our dreams of becoming doctor in Australia. So how to do the AMC MCQ questions? As I just mentioned in the previous slide, guys, when you're doing an MCQ question, make sure why you've ruled out that particular topic, that particular option, and the best way to do that is obviously to learn about that particular topic. So that's how you should do every single MCQ questions when you're studying, when you're preparing. Why did I rule out this particular options? And you're going to choose the most appropriate option. See, some options, all the 5 options might feel inappropriate, but still you're going to choose what will be most appropriate for my question. So that's how you do your AMC MCQ questions, the A-type questions. So one other question that a lot of you guys were asking me was, where do I get the recalls? Guys, you need to socialize. You need to find people who are giving AMC MCQ examination at the same time or in the same time frame that you are giving, because those people are going to help you with recalls. Back when I studied last year, so we had a lot of group, and I had to socialize with a lot of people to find these groups also. Because if I give you a few groups that I was there in, the groups are still there in WhatsApp, but we guys have all given our examination. The groups aren't active. So you need to find the most active groups, people who are giving examination in your month, and find recalls there. You have to socialize with people and ask them for groups. If they do know groups, they will obviously share you the link. Guys, one thing that I learned from this AMC MCQ pathway is there are a lot of gods and angels who are there to help you guys. I've really wondered, why are these guys helping me so much? I don't even know them. But there are a lot of people who are so open-minded to help you in every possible way. So just try and connect with a lot of people. If they know about any groups, obviously they will tell you, and join those groups, and you will get recalls from all those groups. Some of the platforms which helped me were mainly Telegram. In the Telegram, there is a common group, AMC preparation group, if I remember it right, and there are a few other AMC MCQ groups. Just search AMC MCQ, you will get some groups there, and make sure that you join an active group. There can be a lot of inactive group. If you go and join IMG, November Australian group, November 2023 Australian MCQ group, see, that group is inactive because everybody gave their examination. So there is no use in joining those old groups. Try to find out new groups, recent groups with people who are giving the examination at the same time that you are giving. Those people will be motivated to do the recalls, motivated to study, and you need to find such groups. And the only way to do that is you need to search Telegram, you need to search WhatsApp. We had a group, Recall 2023, back when we prepared. That group was so active, and it really helped me through my examination. And just thank you for whoever made that group. If you guys are seeing this video, that group was really active, guys. So you need to search and find a very good active recall group if you haven't found any. You can also search through Facebook. You can also search through Messenger, and these are the platforms where I got my recall questions. In Facebook, guys, if you there is a Facebook page for Amedix. You need to send a request to the admin there, but you can get a lot of recall questions from there also. But even otherwise, if you search Facebook, you can get a lot of pages where recalls are being posted. Just search for AMC MCQ. You will get to find a lot of people. You will get to find contacts and groups where you will get recalls. It's not going to be a tough job, guys, because a lot of people are doing their AMC MCQ examination now. It's becoming a lot more popular. So you will get recalls, guys, and I want you to do recalls also. So guys, another question is how to do recalls. Should I really do them? Because To be honest, I did take a coaching. There are multiple coaching institutes that are there. I'm not picking up any single coaching centers. They are all equally good. There are many coaching centers now, some few that are newly emerging also. So, with coaching, guys, I need you to talk personally to the people who gave their coaching and choose which is the best for you. I did Dr. Shahriar's coaching. And it was a good coaching, and we had a group, and the group, Dr. Shahriar's group, is a common group in Facebook. You can join that group also. Just send a request to him. He will accept you into the group. You will find many recalls there also. I forgot to mention it in the previous slide. You can find a lot of recalls there also. One thing that really helped me was that particular page, guys. You will find a lot of people to communicate. You will find a lot of people to socialize there who will be actively participating in the recalls. But the problem is, guys, even I had the same question in my mind. Should I really do them? God, it's so confusing. Because see, recall is a question that people recall from their examination, right? You have 150 questions in your exam. It's not humanly possible to remember every single question in the best possible way, right? It's just a part and parcel of the question, and it's just few options that they might remember. Sometimes these options can be mixed with some other question. See, it's not possible for us to remember everything, right? But they do give us an idea about how questions can be framed in the examination. There are few people who remember the question really well, and I've really wondered how they do that. And they do give a very perfectly framed questions also. But guys, I will tell you how to study recalls. Please do not by heart recalls. Recalls are not to be by hearted because AMC is really clever. They know you guys are getting recalls and you guys are by hearting the recalls. They have a way in confusing you. They can, the same topic or maybe even the same question, they can change. If in one of your friends' exam, they got the question being asked was, what's the treatment? In your examination, it will be the same topic, but you will be asked for the investigation, right? So they can change question in every possible way. Okay, so that is why when you read through recalls, I know recalls are haphazard, all the options will not be present. So answering like, okay, you get only option A, option B as your recall, you get only a part of the question, and you say A is the answer. See, that's not right. A needn't to be the answer. You read through the entire question in your exam, you have three other more options, and then you will find, okay, A is not the answer, D is the answer. It can change, right? So how I want you guys to read through and study recall is read the topic associated to that recall. If you have a particular recall question that came from, say, pediatrics, maybe from fever and rash, it was a question of fever and rash. Read through fever and rash, read through all those cases that you have under fever and rash. Like, for example, read through Kawasaki disease, read through scarlet disease, scarlet fever. So, read and study all those topics. If you feel that the particular question is framed and it is coming under Kawasaki, read Kawasaki really well, because the next time the question that might be coming will be asking for clinical features. Then the later time again it will be coming for asking for the management, or maybe for the investigations, or maybe the presentation. So it keeps changing, guys. So recalls is not to by heart any particular answer that you're getting there. It is to understand and study the topic in a complete entire 360 view of that topic should be studied, so that how much ever twisted AMC asks you that question, you should be able to answer that. That is how you should study recalls. Initially, when I didn't know how to study recalls, I was looking through two options and a halfway built question, and I was confused about how will I answer this question. The question is not there, the options are not there. How am I going to answer this? I really did spend a lot of time frustrating about that, which I do not want you guys to do. Recalls is to get an idea of the topic, right? You see the recall, you understand what topic that they want for us to study and read through that topic. Some recall questions would be framed well. So in that case, you can obviously do that also. But keep in the back of your mind, study that topic perfectly. So the next time, how much ever they twist that question, you should be able to answer that. So you should really study recalls, guys, because a 50% of the questions is from the common pool. They're going to put up the same question, although they change the way they frame the question differently, but the same 50% pool questions are going to come again. So you should really do the recalls, but maybe if you change your method of doing recalls, you will feel a little bit more happy doing recalls rather than being frustrated seeing the haphazardly built recall questions. So another frequently asked question was study partner. Is it a must? Well, guys, getting a study partner who's going to give the examination in the same time frame like you and who is as dedicated as you to give their examination and pass their examination is very difficult. It is difficult. So I do not want you guys to frustrate thinking, oh my God, I did get a study partner. Will I now fail the examination? No, guys, you're not going to. You do not need a study partner to give your examination. If you have a study partner, that's good. But even if you don't have, you're going to study the same questions from the same book. You're going to refer to the same websites, do the same MCQ questions, and you're going to give your examination alone. You can do it on yourself. You do not always need a study partner. But guys, just check through various platforms like Facebook. When you see people answering recalls, just ask them, when are you giving your examination? And talk to them and understand if you feel that they are as motivated as you and if they're giving the examination the same time frame, and also see if they're working or not, because if they're working, their study schedule will be different from yours. So you will have to check a lot of things to get a good study partner. But guys, it's not a must. It's not a necessity. Study partner is not to do a combined study, guys. See, I'm not a combined study person. I need to sit in front of my books, read, act and enact it to myself and study like that. I am a solo study person. I'm not a combined study person. So there will be a lot of you guys who are like me. You do not need a study partner for combined study, guys. I'll tell you why you need a study partner and how I studied with my study partners. So to be honest, guys, I frustrated a lot because I wasn't getting a study partner. I got few study partners initially, but they weren't as motivated in the path because their dates weren't booked. They were working, so things weren't going effectively. So I was so depressed at that moment because I wasn't getting a study partner. But guys, I do not want you to feel the same way. That's why I'm telling you, study partner is not a must. If you get a good study partner, that's good. But even if you do not get a study partner, you're still doing the same job, and I'm pretty sure you will pass if you give a good hard work studying your topics. So in my case, close to my examination, maybe a couple of months before, I got few study partners who were giving examination. I gave examination on August 2023. So I got few people who were giving examination the same month. So those people were so helpful to me, and not only helping each of us out, like whenever you have a doubt in a particular question, you can ask them that question. They will help you out with that, because sometimes sitting with the same question, reading through guidelines and understanding that can be difficult. But if you ask somebody for help, if they go through the guidelines and they will tell it back to you again, it's going to be easy for you. And if your study partner asks you a doubt, you will search every possible guidelines to explain the answer to them. You are reading, you are understanding, you are teaching them. That's a three-way studying that you are doing. So that is something that you can do with your study partner. I will not say study partner is for combined study. I did see a lot of people who are, studying together, but that's up to you. If you are a combined study person, obviously you can study together with your study partner. But me and my study partners, what we did was we used to discuss questions like if I had any doubt, I used to ask my study partner. She used to give a good search about the topics and explain it back to me. I used to do the same. So that's how we studied. And my study partners were actually, I was blessed with few girls who were really wonderful. We even shared our stress and tension towards our examination. So um, that's why you need a study partner, guys, to share your feelings and your emotions close towards your examination, especially, and also to ask your doubts and clear your doubts and get an idea how the other person is studying. But even if you do not get a study partner, guys, it is not important. I did not have anyone to tell me that study partner isn't that important, because I spent a lot of time searching for study partners and crying because I did not get a study partner, which I do not want you guys to do. Study partner is not a must. You can try to get some study partner, like maybe search through Facebook, the same groups that I told you, people who are actively participating in recalls. Maybe you can ask them when they are giving their exam. If they're giving their exam in the same month as you can maybe ask them the doubts. You don't need a fixed study partner, guys. You can just socialize with multiple people and ask them doubts. If they are, there are a lot of helping minded people, as I told you, so they're going to help you. You can have multiple study partners. I had a lot of study partners who are very, very good to help me out with whatever doubt I asked. So that's how you should go about with study partner, guys. It's not just finding one person who's going to help you out throughout. No, it's going to be a lot of people who's going to help you. They are going to ask you doubts also, you're going to help them. So it's basically a community that you develop, asking your doubts and clarifying your doubts, and you do your work alone. You are going to put your hard work to study your textbooks, to widen your knowledge. That's something you have to do on your own. It's not something a study partner can provide you with. It's something that you need to develop on your own. So even if you guys, even if you did not have a study partner, did not get a study partner, that's totally fine. Just socialize, ask doubts to any people that you find on the social platform. They are ready to help you guys, right? You do not need a single study partner to study, because it's an MCQ examination. It is something that you are doing on your own by studying the topics. That's something you can do on your own. You do not always need a study partner for that. So trust me, guys, even if you do not have a study partner, you are going to crack this examination if you put in your hard work, right? Now, should I book a date first or pick a date after full preparation? So, guys, the joke is, even if you get a 10 years time to prepare all these topics, guys, you're never going to be fully prepared. That's how medicine works. You're going to read through them, you're going to forget them, you're going to study them. The guidelines changes, you're going to study them again, you're going to forget them again. This is going to happen. So, you guys, you're never going to feel that I am 100% prepared to give the examination. I don't think that's ever going to happen. So what I would recommend you guys to do is pick a date that will give you about 5 to 6 months of preparation. Choose a date, because only if you have a date will you be, will you get that stress and that adrenaline rush to complete the topics in that time, and that will only help you give a focused and dedicated study during that time. So I would recommend you guys to choose a date that will give you 5 to 6 months of preparation and give your examination. As I mentioned in my previous videos, you do have options of postponing, but I wouldn't recommend you guys to postpone. If you've booked your date for August 11th, see, for example, now it's September. So if you've booked your examination for next January, sorry, there is no examination in January again. So if you book your dates for February and you've booked it for February 20th, unless and until you had some medical conditions in between these time period where you couldn't study at all, maybe then you can postpone. But if you have given yourself a 5 to 6 months thorough preparation, guys, you are going to feel incomplete even the month before your examination. You're going to feel incomplete even the day before your examination. You will feel that I forgot every single thing. That's natural. It happens, guys. But just give your examination. Do not simply postpone your examination if you're feeling I'm not fully prepared, because you're going to feel that even if you get 10 years time. So my recommendation would be pick a date, give yourself 5 to 6 months of preparation, give your examination. Just work hard, you will clear this examination. Now, any superstition with dates and months to choose examination? So back when I was doing my examination, there was a lot of superstition. Do not book your examination in July. It's going to be the toughest examination. But trust me, guys, that's not true. A lot of people pass their examination in July, but a lot of people did not pass their examination in August when I gave my examination. People said August is going to be easy month, but there were a lot of failures in August. So superstition about months is just superstition. I don't think you need to give any hearing about that. You give your hard work, and if you are destined to reach Australia, God will help you pass your examination. So I don't think there's any superstition with months. I don't think you need to have any either. But with the dates, guys, I would recommend you to choose the last dates. Like for example, in August, when I did my examination, if I'm not wrong, the exam started from 6th or 7th. There was exam on 8th, there was exam on 10th, and then 11th and 12th and 13th also, if I remember it right. It's difficult to get dates, the end dates. Like it'll be difficult for you to get the 11, 12, and 13, the last 2 or 3 days of the examination. But I would recommend you guys, if you get chance, pick those dates, because the reason why I'm saying this is the recall of your exam month is very important. Like I did my examination on August. I did get my recalls from the first date of examination that started in August, and me and my study partner, we were solving that. We see the recalls are going to be incomplete, but what we did was we learned and studied the topics that were asked in those recalls. And to be honest, we had a lot of questions that were repeating or revolving around those topics in our examination. So if you guys choose an earlier date, the first date or second date, you will not get enough recall. So that's why I would prefer you guys, if you get a later date, maybe go pick that, because solving few recalls of the month when you're giving the examination is going to be helpful. Not by hearting the recalls, but reading through the topics and studying the topic completely that had been asked. Now, revision. You need to revise, guys, because see, even if you're prepared for 5 or 6 months preparation, from my experience, those topics that you revise and read a few days before your exam or the month before your exam, that's only going to stick into your mind, because you can forget. There is a lot of things that you're learning. So revision is very important, guys. So what I did basically was, this is something that I sticked onto my wall. So basically you have 150 questions for 210 minutes. Just forget this box, guys. I just got the timing wrong there. It's not 195 minutes. When you're starting with 150 questions, you have 210 minutes. Please do count back when you reach 100, like you've done 50 questions. So how much time do you have remaining? Just count it like that. This table is wrong. I'm so sorry about that. But count yourself back and prepare a table like this. So you will have an idea. When I reach the 100th question, this should be the time in the timer, right? Because you shouldn't have spent any more time than what's there in that timer from what you have already scheduled for yourself. Give each question 1 minute and 24 seconds and prepare a table like this, so you will be aware how far you are managing your time in your examination. So you should be aware of this timing, and not this timing, but the timing that I want you guys to make with 150 questions in 210 hours, 210 minutes, and I want you to stick to that time in your examination. No matter what, please do not sit and think about the question. Please move forward, answer and move forward. And even when you're practicing and doing the recall questions, and even when you're doing other multiple questions, keep the timer and do the questions so that you will get an idea how to do and solve MCQs really quickly. Now, the documents, passport, driving license, and the placement letter should be taken for your examination. So I just stick this onto my wall so that, it sticks into my brain as well. So maybe even you guys can make something up like this and stick it onto your wall. So what I want to tell you about revision is at least a month before your exam or 40 days before your exam, start your revision. So this my examination was on August 11th. So 40 days before my examination, I started my revision. So I kept few days for each topics, and I made sure that I completed that topic, like not reading every single line, but rushing through the topics the notes that you made, covering every topics and making an idea, revising them. See, revision is not reading A to Z of the topic. It's just looking through the topics that you've highlighted, the topics that you've made note of, to give a quick screening of what all can be asked in that question, right? So this was how I made my revision plan. I want you guys to make your own revision plan. If you are a slow learner, maybe you might have to give a little more time. If you're a quick learner, maybe you can give only less time, or maybe in this period you can revise twice or thrice. So it depends on you. This was what I made for me. I just gave 1 day for respiratory and 1 day for GIT, 1 day for endocrine, renal, CVS, few days for CNS. And so this is how I planned. You make sure you give few days of break also in between of this rushed study. You need to free up your mind, so give yourself break time also, come back, study again. So sometimes, guys, it will not be possible for you to complete the topic. So you can see few days I've not put a Indo, I've not highlighted it, meaning I couldn't complete my revision in that topic. I started pediatrics here, but I couldn't complete pediatrics in a single day. That's fine, move on. God will show you the questions that will come for your examination. Trust in Him and just keep studying. The next thing is my examination, that is in August. Examination started from 7th of August, and these were the dates where examination was conducted in August. And I made sure these days that will only be for revising the recall questions or the recall topics that is been coming. So I kept aside these 4 days just to study the questions that have been asked from, or just to study the topics from which the recall questions were coming in August. So that's how I prepared for my examination, and I really do feel this is a very good way of preparing and revising in your examination as well. So how to prepare on the month of my exam? The same thing that I told you guys, just finish all your pending works, complete your revision, your 40-day, 30-day revision, whatever time that you're giving, complete everything before the first date of the examination on your month. Try and choose a last date if possible for your examination, so you get enough recalls and you can study through the topic of recalls that has been coming. So that means you'll have to give at least 5 to 6 days solely for studying those important topics. And the recalls can be confusing, guys. Don't stress on that. Read the topic, and the exam can also be confusing. It is like that, guys. So don't worry about it. The exam can be confusing. Just pray to God and click the answer that you feel is the most appropriate, and just move on. He is going to help you guys. So that's how basically that's how I want you to prepare on the month of your examination. Now, on the day of your examination. So guys, I want you to have a very good sleep the day before your examination. Most of you guys would be like me. You will try and sit throughout the night, but please don't do that, guys. I did prevent myself from doing that. I gave myself 6 to 7 hours of sleep before my examination because you're going to sit for 3.5 hours in the morning. You're definitely going to fall asleep during your examination, and you don't want that. So give yourself time, sleep well, and eat your breakfast. Don't eat a heavy breakfast because you might again sleep in your examination. So eat enough, and you are going to sit for 3.5 hours for your examination. You will have some initial checking process. So remember to take all your identity documents and your placement letter. They're going to check you and they're going to take in your examination. And you will have few things to do, before your examination starts itself on the computer. You will have some verifications to do. You will be given a pen and paper to do your calculations. Like in biostats, you might have some calculations. So you will be given a pen and paper, just that you just have to keep them back when you're leaving the table. Do not take anything, any paper or pen by yourself. They will provide you with all that. And giving your examination, one other thing I want you to remember is please stay put to your time. Manage your time. Do not spend another extra second for a question if you feel confused. Move fast because you need to finish the 150 questions and you cannot come back and review your answers also. So make sure you complete your all 150 questions in the stipulated time and manage your time well also. And on the day of your examination, guys, I know you will wake up early in the morning and you will start revising everything. I did that. That's okay. If you want to do, you can do revise topics. And I also carried all my book to my examination center, also thinking I'll just have a quick look through all the topics on the day of my exam. But that didn't happen, guys. You reach your center, they're going to take you in. You cannot revise anything. Don't carry your books to your center. Whatever is possible for you to revise on the morning of your examination, just revise. Then it's up to God, guys. You gave your hard work, leave the rest to God. He's going to give you a good, he's going to pay for the efforts that you give. So on the day of your exam, I just want you to sleep well, eat well, and relax and pray and manage your time and give the best for your examination. Now, you will get your results for your MCQ examination in the portal, the same AMC portal that we made. But there has been recently a change. Results will now be released at 4 p.m. on the Friday, 3 weeks following the MCQ examination. So this process is going to start from, it started from September 6th because previously the results were released at 9 a.m. on Thursday, 4 weeks after MCQ examination, but that has changed. Please note, guys, please look your AMC portal. 3 weeks, the third Friday after your examination at 4 p.m. for your results. And wish you guys all the best. And I'm pretty sure if you give a good hard work, pray to God, you're all going to pass your examination. So that's the end of my video for today. It was definitely a long video, but this is what I did for my examination. This is what I would recommend you guys also to do for your examination. And I hope it will be helpful for you guys also. Please do share with me what you felt from my video. And also if you have any doubts that I can help you with, please do comment them so I can maybe come up with another video about it. So guys, just trust in God and do your best. Do not frustrate and stress too much about it because it isn't ours to decide. How much ever effort we put, if you are decided to get into the Australian healthcare system, even without preparation, you will get into the system. I have seen people who, with work, they prepare for 1 or 2 months and they get through the examination. So it's destiny, guys. You need to give your hard work. I'm not telling don't put in your effort and you will pass your examination. No, I want you to put your efforts, study well, and just trust in God and leave the rest to Him. And do remember to give yourself some self time. Please do, go out with your friends, spend time with your family, eat good food, see some good movies, and also get good rest. And give yourself some break also amidst the 5 or 6 months because it's going to be a very stressful journey, which obviously it's going to be a stressful journey for you guys. But I'm pretty sure the day when you get your examination results, you're going to have a more than 100-volt smile and be really happy for the fact that your efforts really paid off. So all the best to all of you guys who are going to give your AMC MCQ examination. And if you need any other help from me, please do let me know in the comments. Bye bye. See you soon.